legitimately, I think I am one of the few types of physicians that can tell my friends, whatever you see on TV, all those crazy TV shows that you watch, I'm doing that, right? Like, that's me. A lady was brought in. It was a really busy shift, so I hadn't had a chance to take a look at the notes beforehand. And the daughter was sitting there, the lady was on the bed, and I was like, hey, like, what brings you in? And she's like, oh, like, my belly hurts a little bit. And I was like, like, why is she kind of back in our mental health area? And then as I left the room, the daughter followed me, and she's like, hey, she's really good at faking it, right? I was like, what do you mean? And she said, she tried to kill us. She tried to kill us at home.
I cannot wait for people to listen to this conversation.
Same, dude.
This is going to be awesome. Yo, assalamu alaikum. This is Yusuf. As you know, I'm trying to choose my specialty. And today I got to speak with, on this episode, I should say, speaking with Dr. Hussein for ER medicine. He's in his last year of residency. And this was actually the field that I was most interested in and thought I'd go into when I came to medical school. The reason being is because I spent some time, about like 6-7 months, medically scribing in the ER. And so I took a lot of notes for the doctor, so I got to see a lot of cool stuff. I really like the specialty because it's, first of all, only 3 years of training. It's very much of a mixed specialty, so you get to do medicine, procedures, and I love that their specialty is life-threatening diseases. People come to the ER as one of the most fearful nights of their life, and so you get to be that person that comes in and reassures them sometimes. Or you're that person who comes in and saves them. ER medicine is definitely one of those specialties that I was super interested in. I loved this episode with Hussein. This guy is awesome. He walks around in the hospital with probably the most beautiful hair. You can see this picture right here. His hair is luscious. I hope you enjoy this episode. Make sure to like and subscribe. Your boy's trying to, get that 1,000 subscribers and start monetizing this baby. Come on, man. Hurry up. Come on. Dr. Hussein, thank you so much for coming, man.
It's a pleasure. Thank you for giving me the honor of being interviewed by you.
Appreciate it, man. So you asked me, what made me want to start doing this?
Right.
And, man, I'm telling you, for years, I was thinking of what can I do? I just felt for some reason that being a doctor wasn't enough. Like, just being a doctor, serving one patient at a time is beautiful work, which is why I want to do it. It's my dream job since I was a little kid. But I felt like I was like, man, this isn't like enough impact,
Mm-hmm.
And I think a lot of people, in other words, like my purpose,
Yeah.
like what is my purpose for the world? And I'm not saying YouTube is my purpose, but it's another way for me to impact the world in a much wider audience. And I think that YouTube is so perfect because like I couldn't figure out how I can still optimize all of the skill sets I've gained, like I'm going to medical school. I didn't want like something that's like a whole nother skill set that I have to learn, know? Although this is like obviously a lot to learn, but this is like the most perfect thing, bro, because I can now still benefit people in the world that I'm in, like medicine, Muslim community, community partner, like someone who's always involved in the community, something I've always been like since I was in high school. So this is like the most perfect blend because like I can bring anybody on here, have cool conversations, learn as much as I can from you, and hopefully benefit other people. So I think that's the main thing. I was like, man, YouTube is really, I don't think there's anything more perfect. It's the most perfect portable small business that can benefit other people.
Totally. I feel like I'm sitting with the next YouTube superstar right now. Yeah. I feel like I'm sitting with a great mind, bro. So I will say this. One of the points that you made really spoke to me, and it's one that I've heard before. It's kind of staying in your line of work, but then branching out from that line and affecting people in a different way. So my sister, who's a dermatology resident in New York, had a seminar, a grand round session with, believe it or not, the chair of orthopedics. He came and spoke to the dermatologists. It wasn't about orthopedics, right? Because the two fields don't really mesh, right? They don't intersect. It was more about like work-life stuff.
Yes.
Super accomplished guy. And he was saying the same thing, that as a resident and then as an attending, you could start like a random initiative But one of the most impactful things you can probably do, and easiest things you can probably do, is take your line of work and branch off of it.
Yes.
To affect people in a different way, which is exactly what you're doing. So you've already figured it out as a medical student.
Oh my God, that's powerful. And that's super motivating, bro. I'm glad. Thank you so much for telling me that. I think it's been a struggle because I was really thinking for a long time. I was like, man, this is not enough. What can I do? What can I do? You know? And I don't know, it just kind of dawned on me, and it's been super fun. Like, YouTube is cool. It's like a whole nother creative outlook.
Oh, for sure.
And you know what else is pretty cool? You said, like, hopefully, you know, like, this guy's gonna be next superstar. I hope I impact like as much people as I possibly can. But that's another fun thing about YouTube, is that they're superstars. You know what I mean? It's like I never made it to the NBA, but like this could be like the runner-up. You know what I'm saying? Okay. They have like their own. YouTube has their own like.
We'll see your advertise on the NBA Finals, like during the commercial breaks.
Right.
Pop up, yeah, totally, man.
Yusuf just popping up in commercials.
Yeah,
that's actually kind of cool, man. So hopefully I can be a pro at this, man. That's what I'm trying to do.
Yeah.
So thank God we caught you on a day off, man. Do you feel like you have like a lot of days off relative to other residents in other, like, you know, residency programs?
Residency is such an amazing experience because it pushes you not just mentally but physically, emotionally.
Oh yeah.
And then again, as you kind of get more and more senior, you start getting closer to the light. Right? And by light, I mean, you know, what it feels like to be an attending.
Right.
So as I've gone through my first year, my second year, now my third year, yeah, I have a decent chunk of time off, and it's great. Some of my colleagues are using it to reconnect with their families and kids and take trips and moonlight. Some of us are using it to kind of push ourselves to learn different facets of emergency medicine, explore the fellowships, fly in helicopters, and, you know, spend time in the ICU, and, you know, so there's a lot of time to do what you want to do.
That's for sure. Awesome. You spoke a little bit about like you trying to use some of your free time to go on medflight.
Yeah.
That's so awesome. So could you tell me a little bit more about that?
Yeah. So medflight is one of the most unique aspects about the program here at University of Wisconsin-Madison. We have flight doctors that are not just based at this institute, but that fly in from all over the states to go on medflight. And that's because this is probably one of the only programs in the country that actually lets physicians fly as primary. Other places will typically have like a nurse and a pilot, no one with MD capabilities, essentially. So doing procedures and lines and really life-saving therapies is what we offer on the helicopter itself. And that's why this program is unique. It was one of the main draws for me here. Just to kind of unlock this skill set and this career. And it's a main draw for many applicants that apply here.
So you could, correct me if I'm wrong, this is a fellowship though program, right?
Correct.
So you could still learn a lot of the skills you'd get out of the fellowship as just an ER resident here.
Correct.
That's awesome.
Yeah.
So to what degree? Does that mean like you can still use some med-flight experience in your career as an ER doctor?
Absolutely. And so the folks that I know that do med-flight do not do it full time. They split. So they're in the ER part of the time, and then part of their shifts are on med-flight. Yeah. So it's a very cool addition to the career.
Is that common though, med-flight to like big academic universities? Like if I went to University of Minnesota, they would likely have one too?
Yeah, so as far as I know, Minnesota does not have like an MD program for med-flight.
Okay.
Yeah, Cincinnati probably does, and we're talking kind of really, really big name institutes. But really that's what sets University of Wisconsin apart is this program, among other things.
Dang. So that's awesome. That's really cool. Yeah, being a resident is hard. So right now, how many days work do you work? Like how many shifts a week do you have?
Yeah, it varies. So coming up in 2 weeks, I'll have maybe 6 days back to back to back, and then 1 day off. Next week, I work 1 shift. So yeah, and that's what's interesting about emergency medicine, right? Because truly, when it comes to crafting your schedule, compared to other fields in emergency medicine, you can really dictate how much or how little you want to work. And you can find a practice that will accept what you want.
Is that flexibility there for you as a resident too, or maybe as a third year? Is it more commonly flexible for you?
So the purpose of residency is to get you trained to the point where you can do things in your sleep.
Right.
Like somebody shakes you awake and asks you a question about something that's core to your field, and you can answer it just like that, right? That comes with reps. That comes with spending time in the ED.
Exactly.
So just through the course of residency, you will get that good. But to get there, you have to spend the time that it takes.
Right. So okay.
So residency is a different ballgame altogether.
What's the max shifts you guys have to do?
So it depends on the program.
Okay.
Here, we'll end up doing maybe 20, 21, 22 shifts per month. And then we have like 8 days interspersed for recovery and days off. At other places, it might be a little bit less. But what I would say to medical students is that when it comes to residency, get ready to work and enjoy it.
That's true, man. I guess that has to be my mindset. Even if I'm doing this little YouTube thing and I'm like thinking about like, oh, how can I like fit this in?
Sure.
Because that's like the next like roadblock. I'm right now in my third year of medical school. At UW's curriculum, I've like finished preclinicals and clinicals. We're in our elective phase, right? So this is like the most free time I have. So YouTube is hopefully gonna like encompass a lot of my free time.
Yeah.
But I've been thinking ahead, like, okay, in residency, what the hell am I going to do? Should that factor into my decision at all in terms of what residency I choose?
Yeah, I think what you're going to find, and just saying this because I know you.
Yeah.
What you're going to find is that it almost feels more rewarding in residency. Like all that effort and time that you put in, the studying that you do, the time that you spend in the hospital, you realize that you are doing what you've always wanted to do. And when that hits you, you're just like, man, this is awesome. Like
100%.
this is the dream, right?
Yeah.
Everything that you've studied for, you see the next day. You can utilize the next day to impact somebody else's life. And that's kind of what helps me keep perspective through the process that can be brutal at times. I've had rotations where I've been awake for 24 hours straight, 30 hours straight. And maybe in college that was fun, but as you kind of get through life, you're just like, man, that's rough. But at the end of it, you realize, one, my body is capable of doing that. And number two, some of the work that I did was incredible, right? As an ER physician, I'm never going to do that again, obviously. 24-hour shifts are not a thing. Max, in most places, they're 12 hours. But you learn a lot about yourself through the process, and you realize that, man, I'm really enjoying the ups and the downs.
Oh yeah, man. Okay, let's talk about why ER medicine.
Let's do it.
I think, as you know, this whole series I'm doing is kind of like me trying to figure out what specialty I want to do, and I hope everyone I talk to really tries their best to like sell it. Like, don't be shy. You know what I'm saying? Like, respect to all other specialties is obviously the default.
Yeah.
But like, I want to know like why ER medicine is honestly the best possible choice for anybody who might be listening.
I love this question.
Tell me.
I love this. So legitimately, I think I am one of the few types of physicians that can tell my friends, whatever you see on TV, all those crazy TV shows that you watch, I'm doing that. Right? Like, that's me. Like, that is my life, right? I'll jump on a helicopter. I'll pick up somebody in the middle of a ditch. I'll intubate them. I'll secure their airway. I'll make sure they're alive. We'll bring them back to the hospital, and then boom, I'll hand them off to my team who's going to continue their care. It's anything, anywhere, anytime, and every day is different. And that's what keeps it really exciting.
Wow. Okay, so you said a lot of, I think, big buzzy pros to being in ER medicine.
I got all the buzzwords.
I swear.
All the catchphrases.
100%.
Everything you'll see on like a t-shirt, I just quoted. Yeah, basically.
Exactly. So a lot of variety.
Yeah.
Saving lives.
Saving lives.
Like all the time. That's pretty cool.
Yeah.
So what are some of the, like, why do people, when did you know? When did you know that you wanted to do ER medicine?
You know what? I didn't. I didn't know. Because I was going through my rotations, and I remember talking to my sister about this because she was a year or so behind me. And I was like, man, I like OB-GYN. And then 2 weeks later, I was like, I really like Gen Surge. And then 2 weeks later, I was like, you know what? Internal medicine's pretty cool too. Right? So like,
this is my story of my life.
I liked
man.
everything.
Yes, yes.
And then I got to the ED and everything was there. Like, you know, they say that the most exciting 5 minutes of each specialty are what we get to experience. And it was true. I remember walking in on my first shift asking, where is my senior resident that I'm supposed to be working with today? And the nurses are like looking around, and then one of them's like, oh, there she is. And I kid you not, there was a patient that was being wheeled down on a stretcher with my senior resident on top doing chest compressions. And her hair was like flowing in the wind and the draft and everything. And I was like, whoa. And so the patient was taken to the resus bay. They regained pulses. They did what they needed to do in the ED. They admitted him. And then about 4 or 5 days later, when I checked up on the charts, he had walked out of the hospital. They had saved his life. And that's when I realized, I was like, this is the coolest specialty. I need to do this.
Dude, that's awesome. Believe it or not, when I entered medical school, ER medicine was the one I wanted to do. And the reason why I was like, this job is straight up saving lives. Like when I thought about this when I was a kid, I was like, oh, I want to be a doctor to save lives, you know, like it's going to be awesome. Everybody, like, that's what they think, you know, the doctor's main job is, you know? And so I scribed in the ER and I was like, that's exactly what they do all the time.
Yeah.
That's pretty cool, man. The current match rates for ER medicine, I kind of want to pull that up.
Yeah, please. It's like 99%. You don't need it. Yeah.
You got it.
It's really high. Yeah.
Yeah.
It's really high. For USMDs, it's very high.
So matching into it, but I feel like.
Yeah, if you want to go into EM now as a USMD, now is the time. Like this is prime time.
Really? Why?
And so, you know, there's hesitation, and I'll acknowledge both sides.
Sure.
Emergency medicine, when my mentors were applying, when I was applying, was, I would say, quite competitive. There was a lot of people that were not matching.
Okay.
And it's because it was, as you mentioned, the purest form of medicine, undifferentiated patients that are sick, that are coming in, and you're just like, this is what I went to med school for. Excitement, life-saving, high pay, decent quality of life if you can kind of work with the schedule. But then, of course, as medical student interest went up, the number of programs that were open went way up. So lots of spots. And then, of course, COVID happened, and then burnout kind of hit like an all-time high. And so I think interest dipped. So these days, emergency medicine is not as quote-unquote competitive as it used to be.
Right.
I think when it comes down to it, if a medical student is interested in the field, now is the best time to go into it. Now is the best time to go into it, because at this point, if you are well qualified, you have access to all the top programs.
That's really great to hear, because I think that is a barrier to a lot of different residencies. Like, it doesn't matter how well you sell me how great the specialty is. If you're telling me the match rate's like 60%, in other words, 60% of people who fully apply to that residency get into a residency, and 40% don't. They go unmatched. That's a barrier of entry. I might not go through with that.
Fair enough.
Road. But you're telling me, like, hey, if you want it, you can get it.
Yeah.
That's awesome. If we look at the step average, medicine's step 2 average is 244. When step 2 is all that matters right now. In terms of one of your objective measurements, step 1's pass-fail now. So 244, that's not bad at all. That's actually one of the lower averages. If we talk about, dermatology's 257, ER medicine is 254. So
Yeah.
very achievable.
Sure.
Match rate's 99%. If you come from a solid school or not, you can maybe make it up for it with your step 2 scores and your other application characteristics. But so getting in isn't a problem.
Yeah. I mean, if you show the interest, and obviously it depends on where you apply to. We recently had a group discussion about all of the applicants that have applied to the program here at University of Wisconsin, and they're all stellar. Like truly the creme de la creme, the cream of the crop, right?
Our ER program is amazing.
So, depending on where you apply, qualifications matter far more than scores. But the folks that at least we've interviewed, their scores are also phenomenal. Yeah.
Sweet. So there's many things to consider when you're choosing a specialty. One of the things, so I have like a list of 7 things, okay? Not all of them really apply to ER medicine. Like the first one is a little bit difficult in terms of your it impacting your choice of specialty. But I'll just run down the list really quick. It's unique skill or specialty, right? So like what kind of clinical or scientific interest does that field provide? So radiology would be anatomy, right? Pharmacology/physiology would be anesthesiology.
Sure.
ER medicine. What would you say is there like, an ER doc, you have these skills?
Yeah.
I can think of a couple, but
Totally,
what pops up?
What are some that you can think of off the tip of your tongue here?
The tip of my tongue for an ER doc.
Because you've spent time with us in the ED, right?
Yeah, exactly. I would say number 1, you guys are really quick at making decisions on the spot.
Sure.
I think that after, like you just said, lots of reps, 3 years of like 20 shifts a month is ridiculous. You will really develop this algorithm in your head. Like you kind of know how you have this whole framework in your mind that allows you to really think and make clear decisions that you can be confident in pretty quickly, which I think is super admirable. Like as a med student, I go in that ER, man, I'm struggling to think about what to start on, right? And making my decision, it's literally like I'm dealing with a multiple choice question that has 3 possible answers,
Yeah, which one's the best answer? I hate those questions.
I swear.
Best answer? Ugh. But yeah, no, so I agree with you. I think acting on limited information is a big part of the field.
Yep.
Because it depends on who the patient is, but like yesterday, right? Somebody came in short of breath, huffing and puffing. If we took their vitals and everything was A-okay, I would maybe have some time to go and dig through their chart and check out their last admission and really learn about them. But sometimes we don't have that. Sometimes the oxygen level is going down, down, beep, 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 right? And like you're hearing that, the pressure is on, and you have to act immediately, right? So you get maybe like a cursory glance at their prior record, problems, history, their medications, and then boom, you got to go in. And you got to do something to actually make sure that they get through this.
100%.
And so, yeah, you're right. With limited information, we have to make fairly well-calculated and aggressive decisions at times.
Yeah.
Yeah.
And then the number 2 big thing I would say is for sure, like 90% of your job is diagnosing. So you guys are like up there with, just like internal medicine, you guys are pure diagnosticians.
Sure. I'd love to shift your frame a little bit.
Sure. Okay.
So I don't think of us as diagnosticians.
Okay.
I would say that 80% of my job is ruling out bad things. So to be honest with you, it doesn't matter to me if I don't have the answer a lot of the time. Like I'm not trying to diagnose. I'm trying to make sure that the life-threatening things are not happening. Does that make sense?
Yes.
So like while maybe internal medicine wants to get the answer, for me it's like I want to make sure it's not a heart attack. I want to make sure it's not a pulmonary embolism. I want to make sure it's not your aorta being ripped in half. Yeah.
Amazing.
So it's not, truly saying to you that I know exactly what's causing your chest pain. I'm just telling you, hey, it's not a heart attack. It's not a blood clot. It's not an aortic dissection. It's not anything life-threatening. You can go home.
Wow. Yeah. Okay. That's really cool. Okay. The other thing that I'm interested in is the extracurricular work that's common amongst ER physicians. As you know, some fields, there's, for the most part, one of the things that I learned from Dr. Jeremy Goodman was that really you could fit in other fields of interest within most fields. Like if you want to do policy work, if you want to do research, if you want to do academics, you can mostly fit that in like most fields. That being said, what are the common, obviously it's easier to do certain things in other fields.
Sure.
And maybe one extracurricular is more common than others. So in ER, what would you say is that?
Yeah, no, I love this question too. You're asking some really thoughtful questions. Where did you come up with these questions? I love it, man. That genius mind of yours just.
Well, these
I love
7 questions. Well, these are all 7. Like this specific roadmap I did get from Stanford's website because I was looking up how do you choose a specialty, you know. And actually, they created this nice little roadmap.
Shout out to Stanford.
Shout out to Stanford. But really, they got it from a book, too. They adapted it from the book.
Shout out to that book that they got it from.
100%.
Yeah, totally. We don't know what its name is, but... So here's the thing. I think this is an awesome question, and it kind of ties into the other question that you asked. What is sort of a particular skill set of ours? We have a lot of cool toys in the ED. Right. So when we think about particular skill sets and fellowships and like other kind of things that we can do from emergency medicine, I would say that a lot of our toys come into play.
Really?
Yeah. So when we talk about toys, I'm talking about things like as simple as your, $3,000 ultrasound to something as expensive as your like $8 million helicopter. Those are all of our toys, right? We have a lot of like procedural things that we do. And then we have like a lot of community sort of engagement level things that we do. So the things that I think about that pop into my mind, when we talk about ultrasound, we talk about diagnostic, interventional, we're talking about ultrasound fellowships. Some people will make a career out of being the experts in point of care ultrasound. Patient comes in, short of breath, O2 sat is going down, right? We talked about this patient a second ago. You pop an ultrasound probe on their chest. You can see their heart. You can see their lungs. You can hop over to their belly and make sure that it's not something going on with their belly. I had a patient who was short of breath 2 weeks ago. It had nothing to do with his lungs or heart per se. It was all his liver. Ascites fluid. His liver was basically cirrhotic, and so his belly was being filled up with fluid. And it was pushing up on his chest, and he couldn't take deep breaths, so he was short of breath. You can see that on ultrasound, right? So some people will make that kind of their thing from EM. Other people, as you had mentioned, will go into medflight, will be on the helicopters most of their time. Other people will engage in the community through EMS. They're the ones that are the executives or the managers of the ambulance services to make sure that public health isn't compromised, that it's optimized, among many other avenues.
Right. Okay, that's really cool. So do you think, like I said, you can do anything in most fields. That being said, is it common for you to see people engage in research? Because I feel like you guys do have a really open, your ER sees everything, like everybody comes through, most people come through the ER. It's very diverse, like you said. So I feel like that opens the doors to a lot of, I know QI projects are common.
Sure.
Is that?
Yeah, I mean, research spans from basic science, lab, bench research, to kind of QI, to immediate sort of clinical projects. So among our mentors here, we have people that are fellowship trained in critical care. Their research has to do with critical care things, like ECMO, where you have someone that you can basically put on this ECMO circuit that acts like their heart and lungs. And they're looking at how that affects mortality, survival rates. There's people that are doing all sorts of AI projects, looking at models that can help workflow in the ED, because we are fast-paced, right? So to make us more efficient, they're working on models that can assist us as we go through our workup with patients.
Right.
There's people that will work on applying protocols to the helicopter, medflight. We have protocols when we're on the ground in the ED those things don't necessarily carry over or need to be modified for the helicopter. So people will work on investigating what works up there in the sky at altitude.
Oh, wow. So not only, so there's plenty of spaces of so many questions you can ask. Much. Oh my God, that's awesome. The next thing you want to consider is patient content and continuity. What do you think about that in ER medicine?
We have continuity.
Yeah, we don't have any continuity.
We have continuity sometimes. A lot of times, it can be people that are either very sick that come back and forth, or, and this is one of the struggles at times in emergency medicine, you might have continuity with patients that tend to abuse the system. I think what it does more than anything is that it highlights some of the ways that our health system is broken, and it's unfortunate. So what ends up happening is you actually have a lot of ER docs that then turn their eye towards public policy and kind of shift over to that arena. A lot of ER docs end up going into the executive roles at hospitals. So working as COOs, the chief operating officers, where they interact with all the staff. The CEO of this hospital is actually emergency medicine trained. And I think a lot of that drive stems from what they see in the ED, because we see societal dysfunction at its very foremost.
That is actually kind of, you guys have something that's very unique to the field, where you really get to experience the shortcomings of the healthcare field. Because people who are you'll find all sorts of issues, people coming in with chronic disease that is now decompensated. What's going on? You have to now figure out what the problem is. Is it the patient? Is it the plan?
Right.
What's going on? So you really, and then, or you just continuously see I bet the ER was full when there was the opioid crisis, drug addicts and people who suffer from homelessness. The disease they suffer in coming to the ER, because you don't need to come in with any sorts of health insurance walking into the ER. You just come into the ER.
Correct.
So you serve absolutely everybody.
It's the safety net.
Yeah.
And obviously as medical students who are exploring the field, the fact is that you will see a lot of very sick people, and you will save a lot of lives. But at the same time, a lot of emergency medicine is also kind of navigating these social issues. And that can be just as invigorating for some people or less exciting for others.
So the last couple things is work-life balance and earning potential. So in work-life balance, I brought this really cool figure. It's from this one paper where they made family medicine. You can kind of see it here. Let me just hold this. They made family medicine the zero, because they work, and it's a survey of 6,000 physicians.
Sure.
And they did multiple different specialties. There's a few that are not mentioned. Family medicine is the zero, where they work 40 hours, 9 to 5,
Sure.
Right? It includes administrative work as well, though. So, and other things that are included in the job. And so all the specialties are compared to it. And ER medicine, and over the course of the year, works less than 295 hours. That's about less than 5 hours a week compared to family medicine.
Sure.
Right? So in terms of work-life balance, it sounds like ER medicine is one of those work-life balance jobs. What do you think about that? Is that true? Do you see that?
I think it can be. It depends on who you are and what you prioritize.
Sure.
The way that I think of job satisfaction is the 4 S's. That's how it was taught to me.
Okay.
So the 4 S's of satisfaction, one is the setting. So it's where you are, who you're working with. Do you actually enjoy all of that?
Okay.
Number 2 is the stuff that you do. Do you enjoy what you're doing every single day or whenever you go in? Number 3 is the salary, right? Do you feel like you're fairly compensated for the work that you're doing, for the time that you've put into training yourself for that work? And last but not least is the schedule. So the way that I was taught was that if you have 3 out of those 4, you're good. This is a great job. If you have 4 out of the 4, dream job. Awesome.
Excellent.
Right? 2 out of the 4, you might start thinking about looking elsewhere. Yeah.
Dude, that's a really great framework. So setting, salary, I'm not going to recall for
schedule,
and
and the stuff that you do.
Okay.
Yeah. But when it comes to emergency medicine, I think for a lot of people, the 3 out of those 4 is just spot on. The schedule can be tough for some people.
Oh, yeah.
So while we tend to work less, right? Like I mentioned earlier, next week I have 1 shift. For me, that's like not enough. Like I want to have at least 2 or 3 shifts per week. Otherwise I, go into withdrawal. If I have more than that, I'm finding that, I tend to get bogged down with the notes and it gets a little bit too busy because it's intense work. That's just me. Other people will be totally different. I think what's cool about emergency medicine and what sets it apart from other fields is just how customizable it is. So I was speaking with another friend of mine who is married to a partner who's an orthopedic surgeon, and she is in emergency medicine. She decided to go part-time. She is loving her life. Does high-impact work, works about 2 shifts per month or per week, so about 8 total per month part-time. And just feels really, really good about her job and her work. And it's awesome, right? And that's kind of what you want. You want all of these years of education and investment to pay off and have that job that you really adore. I think emergency medicine offers that.
That is awesome. So it seems like it's definitely like A-level work-life balance, in my opinion. I guess the setting, the schedule, for all people could be a challenge. But I feel like even depending on the personality, your own, temperaments, the setting could also be a challenge for you, I guess.
Yeah. Yeah, certainly.
Because it is a hustle and bustle type of environment.
Yeah,
for
you
sure.
bet. You bet.
Yeah.
Yeah.
I'm definitely one of those that love that, though. I think that I definitely don't want to, when I work, I want to be like moving. I want to do stuff.
Totally. We're moving.
Yeah, exactly. Earning potential is really cool, too. It seems like ER medicine actually had a pay bump, according to the most recent Doximity report.
Yeah.
ER medicine had a 6.2% compensation growth. So it's actually the largest amongst all other fields.
Sure.
The number 2 and number 3 is pediatric infectious disease and pediatric rheumatology, where they had like a 4.9 and 4.2 respectively increased growth. But so the average compensation is $385,000.
Yeah, that number doesn't surprise me. It doesn't surprise me. And as I'm talking to my colleagues who are now looking for jobs, I'm hearing things from 400,000 to 500,000 to upper 300,000s. It's hard to find anything lower than that.
Yeah. Wait, say those numbers again?
So from the conversations that I've had with my colleagues that have graduated from this program, they are looking at offers from like the low 400,000s to the upper 400,000s to even $500,000.
Wow. Working how many shifts? What does that look like?
I'm assuming that they're working like 20, maybe 17, 18 shifts per month.
Gotcha.
But frankly, I don't know the exact details of their contracts.
For sure, of course.
It's going to be less than residency hours for sure.
Certainly.
But it will be full-time EM attending hours.
That's super awesome. That kind of compensation, I guess. So you can't say work-life balance or compensation would be a barrier to the choice of ER medicine. Really.
The thing that I think makes people hesitate is the fact that the ED is open at nights, on weekends, on holidays, and somebody has to staff it during those hours.
Yeah.
So that means that, your vacation plans might not coincide with like friends and other colleagues. You might be here on the 4th of July.
Yeah.
Right. Those things can be difficult for people.
For sure.
Yeah.
Yeah. For me, honestly, that makes sense. That makes sense why that would be an obstacle.
Yeah.
I think growing up as a Muslim, that's like not an obstacle at all. Because none of these holidays really, fit in my schedule either.
Yeah.
And so I would have to like, in fact, it might actually benefit me.
Yeah, maybe. And what I think is awesome is, again, as like a practicing Muslim,
Yeah.
I requested that I have night shifts during Ramadan so that I can recover and sleep during the day. And, I'm fasting during the day.
Right.
I don't want to be running around the hospital. And now I have essentially night shifts during Ramadan, which is awesome.
That is perfect.
It's great. Yeah. So like when it comes to schedule flexibility, it's there. The question is, can you handle that sort of twisting and turning of schedules long term?
Yeah.
And a lot of people struggle with that. So working night shifts when you're in your 40s on a Saturday night instead of being at home with your family can be a big downside. And, we have to recognize that.
Yeah.
At the same time, you're doing some amazing work.
Right. Sounds great. I think those are all the pieces and pillars that I'm considering in terms of choosing a specialty. So ER medicine is definitely up there for me.
It's a wild time.
It is.
Come join the party.
Thank you, man. A couple things I wanted to mention to you. I put in ChatGPT. What are the cons to being in ER medicine?
I love it. Good old ChatGPT. Let's see what ChatGPT whips up for us.
Number one thing they said was the stress level. They said the high stress level, the fast pace, the unpredictability nature of the ER makes it a con to the work field. Is that always true though?
I feel like it's a double-edged sword.
Oh yeah. Okay. Okay.
So for some people, that might be a big con,
Right.
and they're like, nope, going into dermatology, like, see ya, right? And I say that in jest because, again, my sister's a dermatologist. When she was doing her EM rotation in med school, she was in like the inner city hospital. They were on lockdown because there was like a threat or something in the area, and she was like, yeah, I'm ready to go home now.
Clinics for me.
Yeah, right. For other people, just like being in that sort of bustling, high energy environment with other people that are also like there to clearly make a high impact on somebody's life is just the most exciting thing in the world.
Oh yeah.
So you kind of have to pick, where are you?
Yeah.
Who's this? Who is that?
That was one of an M1.
Which one?
His name is Mohammed. Unless he was he from
He's super sus. Yeah. No, he's my boy. He's my boy.
Okay, sweet,
I love him, bro. He's actually my neighbor.
I had no idea what he was saying.
That's great.
Eventually, he was like, that time I was like, yeah. Oh my God, that's funny.
That's great. No, I love that guy. He's great.
Yeah, mashallah. May Allah make him successful.
This is actually our study area. You know what? I don't think anybody else actually uses this lounge.
Really? This is the
probably,
most beautiful spot.
It's so convenient too. And I don't like to study in my apartment.
Yeah.
I like to get out, right?
Yeah.
So I actually come down here and I study down here. Yeah.
Oh, that makes sense. You're still studying as a resident?
My friend, there's no end.
I guess
there's
you
no
guys
end
do
to
have
it.
like a board exam.
Oh, for sure.
Yeah.
And I mean, you're going to study in a different way as like a resident and an attending as well.
That's true.
Yeah.
That's true. Number 2 thing ChatGPT said was a con was emotional toll. It says that dealing with patients in distress, trauma cases, and sometimes tragic outcomes can take an emotional toll on ER doctors.
Totally. ChatGPT is
speaking facts.
Is speaking the truth. Yeah.
I feel it.
ChatGPT has clearly evolved to the point where it's giving us more thoughtful responses than many that I've come across.
I think part of that is because like every day you're seeing someone at their worst. But I mean that's also could be one of the rewarding aspects of it. Like
I'm just gonna have ChatGPT write my ansers. It'll come up with better answers than I'm coming up with too. 100%. It's ChatGPT, man. All right, but so Loki, the first question was awesome. The second point is awesome too.
Yeah.
It can be really, really tough.
Okay, sweet.
It can be really tough.
I totally understandable. The third thing he said was irregular hours, and you touched a lot about
I will
that.
say this though.
Oh, yeah, go ahead.
As low as some of the lows are,
The
highs are just as high. When you see somebody literally falling off a cliff and you're able to pull them back and say, not today.
Yeah.
It's incredible. Their families are grateful. They are grateful. And some of my favorite cases in the emergency department, and again, this is kind of me as a resident who likes to see things turn around real quick, are the people that come in who look like they're on like the brink of death. And it's like a COPD exacerbation. They're just huffing and puffing and they're like, I'm going to die. And boom, you turn them around in like 30 minutes.
Yeah.
It's wild, right? Shocking somebody out of that weird heart rhythm and them feeling phenomenal afterwards, ready to walk out of the ED. Insane, right?
How do you keep that energy though? Like that level of like if you do that every day, it's like, how do you not become numb to that?
Yeah, I think the amazing part about EM is not just the work, but the people that are involved in it.
Oh, yeah.
And, you know, we all realize that the field has its challenges and that it can be mentally and emotionally really tough.
Yeah.
And it's awesome to just see us band together and talk about things. We debrief after really hard cases.
Wow.
And it's just kind of a part of our workflow. So we tend to process these things in our own unique ways, but also together.
That's beautiful.
Yeah.
That's beautiful. Like I said, irregular hours was also mentioned. You mentioned that. Limited continuity of care.
Mm-hmm.
That's something you have to decide to give up because you're not going to get any of that in ER, which makes total sense.
Totally.
Resource constraints. That one confused me. It says resource constraints.
Right.
The emergency departments may face resource challenges such as overcrowding and limited resource, which can impact the quality of care and increase workload.
Sure.
Actually, now that I read that out loud, that makes total sense.
Yeah.
You guys are.
Yeah. Oh, yeah. For sure.
The waiting room's always full.
It's always
full.
full.
Walk in is full. When you leave, it's full.
Any day that ends in Y.
Yeah, exactly.
It's busy. It's a busy place. And, you know, University of Wisconsin, obviously, is like the flagship in the area, has a lot of resources. If you're in the middle of nowhere emergency department,
right,
you can be in a very difficult situation.
Right.
If you need something and you find that you call UW and they're like, oh, we're backed up, we're full. What are you going to do with that critical patient?
Right.
So that can be very tough.
Understood. With all those with the cons that we just mentioned, burnout is a real concern in ER medicine specialty. That's definitely my biggest fear.
Sure.
I fear becoming one of the biggest YouTubers and making millions of dollars and never coming back to medicine. That's probably my biggest fear. That personality change, you know?
Yeah, that sounds like a nightmare, making millions of dollars and never coming back to medicine. Yeah, totally.
Talk about privilege.
Nightmare. Oof. Goodness.
Nah, but I say that in jest, you know? Who knows how successful I'll be, but like nonetheless, when I'm 40, 50, I don't want to end up leaving medicine because now, you know, I've made more than enough money. So burnout is definitely something that I feel like people, without even that concern, they just say, "Oh, I fear leaving the specialty because of burnout." So how do you navigate that?
Yeah, you know, I have my own views, and then I have the views of people that I've interacted with.
Yeah, tell me yours.
That I found like fascinating.
Tell me both. I mean,
I'll tell you both. Yeah, totally. I'm an open book. So
thank you.
Whatever you want, I got you here. I will tell you about a few different people that I've met first. What I've found really fascinating in medicine in general, but particularly in EM, which is one of the reasons I was drawn to it in the first place. Like the people that I worked with as a medical student, I was just blown away by. Like really insightful, well-rounded, interesting people that had lived like multiple lives prior, right? These were the type that were like drawn to EM, super active and, you know, just really cool folks. We've had people who have been like millionaires come through this program who then said, I don't feel fulfilled. I need to do medicine. And one of our biggest, I would say, supporters in this program here at UW was that guy. He was like a millionaire. He made it big out in California, and then decided to go to med school. I think he was much older than most of his classmates, and then decided to go to residency and did his emergency medicine residency here. And now he's a practicing ER doc somewhere out in middle of nowhere, Wisconsin, just out in the country doing all like the tough EM. And he's fulfilled. He's kind of got his business on the side. He's doing EM shifts as well. And I think a decent number of people have found that formula to work for them when it comes to combating burnout in the field. They will do EM plus something.
Okay.
It's not just pure EM.
Right.
Because you're right. Pure EM, all the shifts, all the time, that can lead to burnout. The work is tough in its own unique ways. The schedule changes can be tough. Don't have to explain that.
Right.
But what a lot of people love is that the field has so much flexibility in scheduling that you can do EM and then you can do some other interests of yours.
Like YouTube.
Like YouTube.
That's super
Like
cool.
YouTube. Yeah, totally. Right? And it's awesome. Like one of my other buddies is going to be training at the national level for jiu-jitsu, and he's an EM doc as well. One of our colleagues here is a device inventor. He invents devices. He invented a video otoscope so that you don't have to crane your neck as you're looking into some kid's ears, right? You just pop the video otoscope in and you see it. Boom, right there.
Wow.
And he does EM as well. He's loving his life, right? My personal perspective has been that I fit into that bucket where I'm going to be doing some EM and then I'm going to be doing something else. There are other people that I know who just do EM all the time. And they are a special breed in my mind. They're built for it.
Yes.
One of our mentors who works in Beloit Hospital, which is kind of the rural area in Wisconsin here, had a heart attack, needed to be admitted here to UW, was seen on the medflight hangar walking around with his IV pole. And one of the other physicians asked him what he was doing there. And he's like, I'm just, making sure that I stay active so that I can get back to work as soon as possible. Just loves what he does.
Wow.
Right? Full-time EM doc. And so, you have kind of all flavors in the field, and that's what makes it so much fun, that it's open to that.
Dude, that is exciting. That is exciting. Those are pretty unique stuff that that those people are doing other things for. What about like just the average Joe that is interested, in ER medicine? Do they have to find something that are you recommending them to what are the options, in other words? What I'm trying to say, so my other option is YouTube. Like I just do, or you say, like my other thing is YouTube.
Sure.
Someone else needs to find something else that also makes them money if they wanted to not work full time, or
Yeah, it's an interesting question because I was kind of surprised by how much I found here when I started my residency here.
Okay.
Every person I would meet had something like really cool and unique going on in addition to EM. Either they were doing something with administration, QI, managing the department. They were doing some other type of leadership, research. They were doing some type of interesting fellowship that would contribute to their clinical EM practice. Or they were doing something totally different that, kind of parted ways with EM and still working EM on the side. I would recommend that whoever goes into EM just like really gets to know the field and everything it offers.
Yeah.
And it's hard to do so because there's so much out there. But make an effort to do so. Just be aware that these are all the routes that I can take after I finish residency. And then really get to know themselves. This is what I like. This is what I cannot stand.
That makes total sense. I think you've brought a very convincing case to EM, man. I think.
I wasn't even trying, bro. Was I supposed to convince you? Oh, I'm just
Ain't that the beauty of
I'm
it,
just
though?
playing Chat GPT. I'm just spitting facts. Yeah. But yeah. So
that's awesome.
The interesting point that you brought up was this whole balance idea.
Yeah.
And for me, I found that I love the practice of EM, and I love what I see and do during the day. I enjoy it at night as well, but then the recovery becomes hard for me.
Oh yeah.
So, like many people, I've started looking for things to reduce the number of nights, weekends that I work. And I found exactly what I was looking for. I found a fellowship that would basically give me a complementary practice to emergency medicine.
Yeah.
So I plan on practicing EM, and then I have this other thing that I'm also going to be doing that I'm really excited for, and that's interventional pain medicine. Super procedural, very tech heavy, life changing, quality of life changing, not life saving in a sense.
Right.
But it's, I think in my mind it's the perfect complement.
That's super exciting, man. I'm excited for you. You start this coming summer, right?
June, yeah.
Dang.
It's coming right up, man. Yeah, time has flown by.
Time has flown by.
Yeah.
Last time I seen you was like you just started the third year, and now we're already like 60, 70% way.
Isn't that crazy?
Yeah, that's crazy. That is wild.
Yeah.
All right. Last thing I want to talk to you about.
Sure.
Mid-level creep.
Mm-hmm.
Should that be a concern in someone? Should that be a valid concern before choosing your medicine?
That is such a big question. I will tell you how my view, and we talked about this earlier, right? Like your view on things as a medical student is one way, and then as a resident, it's a totally different way. And then as an attending, you're just like, well, I was wrong both times. This is how I see it now. So mid-level creep is something that is like thrown around on like internet forums and maybe, talk amongst medical students. The reality as I've seen it is team. There are individuals on the same team with very like particular roles. As the EM trained MD, your role, much like an anesthesiologist MD, is to kind of oversee. I feel like there are mid-levels, and I don't like to call them mid-levels.
Yeah, is there more of a generous title for that?
So I think the appropriate title is your teammates, your physician assistant, nurse practitioner teammates.
Sure, okay.
Yeah. I think your teammates are there for a very important reason, and that is to help you extend your reach to impact the most people that you can while you are working. They have their particular skill sets and their particular limitations, and as the MD, you bring a lot to the table, and I think it is not so much a creep situation as it is we are working together to help as many people as possible. And at the end of the day, everyone kind of reports back to you and says, hey, this is my plan. What do you think? Shall we make tweaks? Shall we go ahead with what I'm thinking? And then you say, yeah, how about this? How about this? How about this? Or yeah, let's do this.
Yeah. I mean, I think everybody should agree that we need more people that could help the patients in the ER, like the need is ridiculous. There's so many people that needs to be seen. That being said, is it also true that you would thus need less ER doctors?
So 2 points. In this program, a part of our work as third-year residents, as kind of final-year residents, is to work really closely with our physician assistant and NP colleagues.
Okay.
And some of the most cool skills, like procedural skills and critical thinking skills that I've learned from these colleagues. It's been awesome.
Yeah.
Right?
Yeah.
Because initially, as a medical student, you're like, there's going to be a divide. But no, we're all sailing in the same ship.
Right.
Their job is to support you so that one day you can come in and kind of sit in the chair and say, hey, like, this is how I'm envisioning things. Can you guys help me get our patients there? Right? And they're doing an awesome job doing that, especially the ones that are here. When it comes to the question that you asked about decreased need for ER physicians, I think as the numbers show, there is an increased need. And there's increasing salary, and just based off of my colleagues' experiences where they're looking for jobs, they always get hired.
Right.
So it doesn't seem like there's a decreased need.
Yeah.
If anything, it seems like there's a higher need for really well-trained EM physicians.
Yeah, I completely agree. I think for some reason when I came to the medical school, that was like within a couple months, everybody's like mentioning like, oh, do you really want to think about ER medicine when there's this creep? But I think that this having more teammates in the field has been and will continue to be a huge benefit to the healthcare system. And you're coming out of a medical school off of 4 years of training after 3 years of residency and have a lot of value and skills to benefit others. There's
Sure.
no way you're not going to get a job. And honestly, I don't think that job market flow is just like something that no med student should be considering. I think at least it shouldn't be one of the top 7 things that you should be considering when choosing a specialty.
I think it's hard not to. It's hard not to, right? Because that is a very hot topic to talk about. The way that I have always told medical students to think about it is kind of those 4 S's. At the end of the day, these are the big things that you think about.
Yeah.
And, if you end up going into a field that is not the most exciting, that you're not really passionate about, but you have a cool schedule and, you're in a place that you want to be in, maybe you'll be satisfied. Or maybe you'll think, I'm not really passionate about this work.
Yeah.
Whereas if you're really passionate about the work, regardless of kind of where you end up, even if you're kind of close to where you want it to be, I think you'll be happier because the job has so much more meaning to you.
That is awesome. I cannot wait for people to listen to this conversation.
Same, dude.
This is going to be awesome. Could we end it off with some of the most craziest stories that you've experienced and seen or heard in the ER?
What a question. Another one of my favorite questions.
Talk to me about it.
As you know, we got plenty. And my question back to that person is always, what is your type of crazy? Are you interested in psych crazy? Are you interested in medically complex crazy? Are you interested in trauma, injury crazy? I mean, the list just goes. I literally have Jeopardy categories.
Oh my goodness.
In my mind. As as you were setting up your cameras here, I was upstairs writing my note, and I was thinking to myself, this is just out of every shift is a script for a TV show.
Oh my
this is just insane. Did this really happen yesterday? 24 hours ago? Wow. Chainsaw to the leg? What? It's crazy, right?
Yeah.
So, the stories just are plentiful, and
okay,
it would take another show altogether to talk about these stories.
Stories. Oh my goodness.
Yeah.
All right.
And I won't say funny because it's somebody else's. It's difficult for whoever's coming into the ED. But interesting stories for sure.
All right. So wait, so are you gonna tell me one or no?
Whatever you want to hear, man.
Okay, sweet.
Whatever you want to hear, yeah. Without violating any patient confidentiality, I'm happy to share some interesting stories.
Perfect. Okay, so I have to pick a category of absolute interesting.
I have experienced things that have sent shivers down my spine, that have left me totally speechless, that have left me in tears. I have experienced, I would say, the full sort of roller coaster of emotions on shift. It's a very, very interesting job.
Okay. Tell me a story that brought shivers down your spine.
The shiver stuff. A lot of the psychiatric stuff. If it is truly, truly disturbing, tends to bring shivers. Or tends to make shivers run down my spine.
Okay.
And one of the very first times that happened was when a lady was brought in by her daughter. And I went in. It was a really busy shift, so I hadn't had a chance to take a look at the notes beforehand that our nurses or whoever else had taken. I just went in. And the daughter was sitting there, the lady was on the bed, and I was like, hey, what brings you in? And she's like, oh, my belly hurts a little bit, and totally normal conversation. And I was like, why is she kind of back in our mental health area? And in my mind, I was like, okay, well, there's nothing going on here. Maybe we'll just do some lab work and we'll send her home. And then as I left the room, the daughter followed me, and we closed the door behind the patient. And she's like, hey, she's really good at faking it, right? And I was like, what do you mean? She's like, she's really good at faking it. And I said, what do you mean?
Yeah.
And she said, she tried to kill us. She tried to kill us at home. And I was like, what? And it was that moment where the shivers kind of went down my spine.
That is actually scary.
And it turns out that the lady had been having like hallucinations and delusions, tried to electrocute her husband and tried to like stab her daughter. And it got to the point where they finally like wrangled her and brought her into the emergency department. Since it was so busy, I hadn't seen like the commotion and the chaos that ensued to get her in.
Wow.
And I had just stepped in and kind of spoken to her point blank without realizing that all this had happened. And then when I went back in the second time, I started asking her about these things. I was like, hey, so like, have you been hearing voices and like things that have been telling you to do things? And she came clean. She's like, yeah, I've been speaking to the angels and they're telling me to do this and this and this. And I was like, whoa, shivers down my spine again, right? If the daughter had not been there, I would have missed that completely.
Wow.
So she had decompensated schizophrenia, essentially.
Right.
She was psychotic.
Right.
She ended up getting admitted. She ended up getting treated. And last I followed up, her symptoms were more under control because of the treatment. But it's like those types of situations that you come across where you're just like, whoa, man.
That is actually, I think the mental health stories are like when I remember when I did my psych rotation, like those are very, very difficult cases.
Totally.
Like, I mean, I could not, it's really hard because it's right now, the challenge is not about like doing like it's not just the complexity of your own job, but it's the complexity of being able to like deliver the job, you know? It's kind of like another roadblock. For example, I think like a pediatrician, like to do a physical exam on a kid is so difficult,
Sure.
let alone like your own, like interpreting your physical exam.
Sure.
So like psych is also in its own right a very difficult.
No, it's fascinating. It's fascinating. There is a great need in this society for proper mental health care.
Yeah.
But what's interesting about emergency medicine is that truly, like right after that moment, the next patient that I saw had like a foreign body shoved into, some random hole, right?
Oh my
And so like you go from that to that, and then you go to like save somebody's life who is having chest pain and their blood pressure is tanking. And then you go back to something like kind of weird, and then you go back to something kind of life-threatening, and that's just kind of fun. It's the fun flow of the ED.
Oh, yeah. Okay, that is, if that doesn't sell somebody, I don't know what could. That level of variety is really cool.
It's so much variety.
You haven't actually seen, like I've like it exists, but like have you actually seen someone like have somebody come into the ER with like something stuck on, like not just their butt, but like their pee hole as well? Nothing like that?
I'm surprised that during your rotation you did not.
Wow.
Yeah, because it's like at least a weekly occurrence.
There's no way.
At least a weekly occurrence.
Okay, did anybody give you a solid explanation?
There is never really a solid explanation.
Sorry,
for why.
You're right.
And I have sort of given up asking for why. I'm just like, all right, let's do what we need to do.
Right.
Yeah.
Could you give me one of the explanations?
Like,
what is one story of how
I
it
fell
actually
on
got
it.
up there?
I fell on it.
Oh my God.
And we both know
that
you didn't fall on it. But it's okay. It happens.
Oh my God.
Yeah, it happens.
Cap. All right.
What an interview.
I know, dude. Thank you so much.
What an interview.
Appreciate it.
Yeah,
Man.
of course, man.
Thank you so much for being a part of this.